What are some of your tips for parents as we've seen some quite high temperatures the past few days today? Obviously, not going to be as humid, but just any tips that you want to talk about.
For sure. Well, summer safety in general is a really broad topic, and my big focus in my career so far has been on water safety and drowning, which is really pertinent when the heat is high. Um, but staying cool is also important because high body temperatures are also really dangerous. But on the other note, like in terms of drowning prevention and water safety, we have some really, really big tips for parents that are really important for keeping kids safe. First and foremost. When you are making a plan for bringing your kid to the beach or by the pool or even out in a little kiddie pool in the backyard, we really strongly recommend what the American Academy of Pediatrics describes as layers of protection. Layers of protection means there's multiple different things that you have instituted as a family to keep your kids safe around water. The most important being direct supervision. So there is no alternative to supervision when it comes to water safety. First and foremost, with supervision, with young kids, we recommend what is called touch safety. What that means is anytime a child is in a body of water, even if it's a kiddie pool or like by one of those small buckets that's filled with water and they're just splashing around, you should be able to reach out and touch your child. So this is a child who's like less than 2 and has really no water skills at all. For an older kid who knows how to swim, what we recommend is having a direct water safety observer. So this is somebody who is an adult who is able to swim themselves and importantly should really be trained in CPR, but that's a different conversation. Who is watching a child directly. That is their whole job when they're by the water, is to have eyes on that kid. They're not engaging in a conversation. They're not on an iPhone. And also, they're not drinking alcohol or using any other substances such as marijuana. Their real job is to keep kids safe. And other things that are really important for keeping kids safe are things like flotation devices. When parents are looking for a flotation device, it's important to make sure that they're U.S. Coast Guard certified. It will say so both on the tag and should say so on the back of the life jacket. They sell these things at Amazon, Target, Walmart. They're really easy to find, but making sure it's U.S. Coast Guard certified means that it has the mechanisms to keep kids safe in the water. And then also swimming lessons. There really is no alternative for a child to know how to swim. It is a life skill that is a life-saving life skill and is really important. And we were both the American Academy of Pediatrics, which is the leader in child health and safety, and us as physicians recommend that kids older than 1 really start engaging in swimming lessons in their local community. But that being said, there is no alternative to supervision, even with a kid who's an adept, fabulous swimmer who's on the swim team. There should be somebody watching that child. And even if the kid is wearing a life vest and running around the pool, they should still have a person watching the child.
Perfect. You answered pretty much all the questions.
Right.
But is there any sort of specific cases or things that you see most common this time of year that come to the hospital?
For sure. Unfortunately, drowning is a common occurrence, especially in the warmer summer months. In Rhode Island, we live in the Ocean State. We're very lucky to live on this beautiful coastal place. But with that opportunity to be near the beach comes a lot of responsibility for parents, but also adults in the community too, who are not children, not parents themselves, in terms of not just observation of kids, but also things like safe pool ownership. Which we can talk about in just a minute, but drowning is the leading cause of death in children ages 1 through 4, of accidental death in the United States, and the second leading cause of accidental death in children 4 to 14. And it's estimated that up to 80% of drowning is preventable, which is an enormous number and a big margin for us to be able to do better for our kids.
So if you want to talk a little bit more about safe pool ownership,
Yes,
just
100%.
a lot of people have pools.
This is a really important topic. So not just for parents, but for people who are not parents in the community, but have pools. And this is both in-ground permanent pools, above ground pools, and even things like little kiddie pools in the backyard, or splash tables. So safe pool ownership means first and foremost fencing. So the evidence-based safest way to keep a pool safe for children and anyone in the community really is a a pool that follows the 4 by 4 by 4 rule, which means there is a four-sided fence. So it covers all four sides of the pool in kind of a big rectangle. It is 4 feet high, and there is no more than 4 inches between each slat in the fence so that kids can't get through it. Chain link fences are actually recommended against by the American Academy of Pediatrics because kids can climb them and scale them unless it's those really, really small diamonds. And then all of those fences should have a door that is an automatic close, automatic latch door that is harder for kids to access. And ideally, they should be locked. The other things that you can do to keep a pool safe are not necessarily evidence proven to be as good as fences. Fences are the best. But if you have an above ground pool, removing the ladder so that kids can't climb up the ladder when it's not pool time. And also pool alarms, which are really cheap. You can find them again on Amazon or Target. These things they float around in the pool and they make an alarming noise if there's a splash that's not supposed to be. And then alarms on doors and locking doors in and out of the home. And then even for a kiddie pool, the kiddie pool really should be. And I mean, anyone who has a kiddie pool and has a child, I'm a mom. You're so busy. You're just trying to get your wet kids in and out of the house. But the safest way to have a kiddie pool is to empty that pool. And when you're done with it and it's not pool time, and like deflate it or turn it over so that it doesn't fill up in rain and their kids don't have access to it when it's not swim time. And even things like 5 gallon buckets, like those big buckets that we all have laying around our house for some crazy reason, those things can fill up with rainwater and toddlers can pull to stand on them and fall into them and can't get out. So either storing them away in the basement, in the garage, wherever you have, or flipping them over so they can't fill up with water. It's just an easy thing you can do to keep kids in the community safe.
Perfect. If there's anything else you want to add, you feel is important to mention that I didn't ask about, go for it.
Sure. Another really important thing for parents and all parents to be aware of, and really everyone in the community in general, is we really strongly recommend that people engage with CPR training. So any time you find a child or adult who is unresponsive and you cannot find a pulse, CPR is proven to the time to CPR is proven to be the best thing you can do to increase their chance of survival. And it's really important for parents to be basic life safety, BLS and CPR certified. And if you are bringing your child swimming, it's a really important skill to have. And you can find access to these CPR type of classes through the American Heart Association. They have online classes that you can like Zoom in. They're all pre-recorded. It's very easy and takes like no more than a few hours. And can really make a difference in a life. And the other piece is in terms of parents finding access to swimming lessons, the way to find swimming lessons and the way to kind of sift through everything that's out there, know it's a good swimming lesson for your child, is you want to make sure that the lessons are taught by somebody who is trained and certified by like American swimming associations. Ideally, they should be lifeguards, but they should certainly be CPR trained themselves. And they should also be teaching things, not just how to swim, but important pool safety things too, like not running by the pool, how to get in and out of a pool safely, and other just like basic water safety tenets for children. And these can be found through things like the YMCA, Boys and Girls Club, US Swimming School, and then Rhode Island Red Cross, all of our resources for those in the community.